it seems to me that potentially dissociation develops a bit from, for example, someone experiencing a quite overwhelming traumatic event most of the time and then almost learning to react in that certain way when maybe stuff's a little bit less traumatic, but at the same time when there are uncomfortable emotions. And what I wonder about that then is there any, I suppose, danger in looking into this sort of stuff? Because if someone's experienced some quite painful memories in their past that, for example, they've been able to numb themselves out of, is it the case that when they connect more with the negative side of themselves in terms of the emotions that they feel, that it could bring up a whole bunch of traumatic memories that they could potentially re-experience in some ways? Or is it more that in therapy you look to, I suppose, reframe the way that someone would experience those feelings going forward without necessarily looking to, hesitate to use the term, but dwell so much on what's happened in the past?
Okay, now I think certainly if very significant trauma memories come up, that's usually when it's important for people to seek therapy to help with that, because there are some quite specific therapy techniques. That doesn't always mean using what's a very regular technique for post-traumatic stress disorder called exposure, which is directly reliving trauma memories. Because for some people that can be quite overwhelming, especially if people have long-term dissociative patterns which reflect that the person does feel overwhelmed by too much distress, and just too much exposure to trauma memories before the person's ready might be difficult. It might be better in those situations that the person learns how their trauma memories are triggered and managing the triggers and anticipating when the triggers might come up and looking for a way of responding to the triggers to look to regulate one's emotions or down-regulate, so to speak, find some way of grounding and calming oneself rather than have to work through the full trauma memories. Some people will be in a position where it's worth directly working through the trauma memories, often with a therapist, to defuse their emotional impact, the emotional intensity of them. But I find often when I see people with dissociative experiences, I go lighter on, often on the exposure, unless someone's experiencing themselves as being very stable in their life. It's a good time to work on that kind of therapy. There's not too much else happening at the time. People have good supports and things like that. But not everybody has to work through their trauma memories using exposure. For some people, as you say, it will be very unsettling. And a range of other situations too. If we feel really overwhelmed, sometimes we just get by any which way we can, including using distraction for a period of time. But then if we do use distraction or have some way of looking to dampen our reactions, then looking to switch on afterwards and keeping our routines of sleep, diet, exercise going, and using our stress management techniques at other times, looking to be within our own skin, experiencing our feelings at other times.